Begin. Enter the room.
Good day. Can I know your full name and age, please?
I'm Lynn Taylor, and I'm 25.
All right. Nice to meet you, Lynn. Is that okay if I call you that?
Yeah, Lynn's fine.
All right. So I see you've come in with recurrent nosebleeds. Would you like to tell me more about that?
What do I say, doctor? Now it's getting a little worrisome. I mean, it's happening a little too often, especially this month.
Okay. I'm sorry to hear about that. Do you bleed from both nostrils?
I only noticed it in one, actually.
Okay. Is there any nasal congestion in that particular nostril?
I mean, my nose gets stuffy when the bleeding happens, but otherwise, no, not really.
Okay. And how much bleeding is it at each time? And how
I
long
mean,
does it last?
it's not much, I would say. It's just that, whenever I put my handkerchief, it's just a few streaks of blood. But yeah, it just goes on for like 5 to 10 minutes. But it's happening so frequently, especially during this winter days. It's kind of really, bothering me.
It's definitely understandable how worried you are. So, do you notice any blood dripping down your throat when you bleed?
No, not that I've noticed, doctor.
All right. Have you noticed any frequency in bleeding in other parts of your body?
No, not really.
All right. And is there anything that you do to stop the bleeding?
Well, I pinch my nose and tilt my head back.
Okay. And did you experience any trauma to your nose before the bleeding started?
No, no, surprisingly, no, I didn't actually.
Okay. Have you noticed any dizziness, any frequent headaches or weakness since this bleeding started?
No, doctor, it's just the bleed. It's just the bleeding, that's all. I don't feel anything else. I just get a little worried whenever I bleed.
All right. So it's understandable how worried you could be. Have you sorry. Have you noticed any fever or any relation to having a cough when this bleeding happens?
Um, no, not really. It just happens on its own.
All right. So just like to move on to ask a few things about your medical history. Do you have any known long-term illnesses, especially related to bleeding or any liver disease?
No, doctor.
Are you on any medication?
No, doctor.
Okay. And that's including blood thinners, right?
Yeah, no blood thinners.
Okay. Do you have any personal, any family history of any cancers, of any bleeding disorders?
No, not really.
All right. And just wanted to find out a few things that are more personal to you. Do you smoke or drink or take any recreational drugs?
I do smoke and drink from time to time. Just with friends, really, but nothing else.
Okay, that's fine. And just wanted to find out, do you have any thoughts on what might be causing this bleeding?
I have no idea. I was hoping if you could give me some clue.
I'll definitely do my best to figure it out. And do you have any particular concerns or anything that you're hoping that I would can do for you at the end of this consultation?
Yeah, I mean, you've also been asking me a lot of this bleeding disorder questions. I've read somewhere that, sometimes it's caused because of that. Just want to make sure it's not that.
All right. Definitely try to address all of that. So I'd like to move on to do an examination. I'll check your vital signs and do an examination that's more targeted to your nose. Is that okay?
Sure, doctor.
All right. So putting together what you've told me as well as the findings that we had on examination, I suspect that you have something called epistaxis. This is just bleeding from the nose. It's quite common, and especially in the environment that you described of cold weather. The blood vessels of the nose, they are quite close to the skin. So the harsh cold air can irritate these blood vessels and cause bleeding.
Oh, okay.
All right. So what I'd like to do for you, we'll do some investigations just to check if there's nothing more sinister going on. It will definitely include a clotting profile, which will help us to see any risk of any bleeding disorders. Is that okay?
Yeah, that sounds great. Sure.
All right. And also, if you notice this bleeding at home, what I'd like you to do, yes, you can pinch your nose, but rather than leaning backwards, I'd like for you to lean forward and you pinch and hold your nose for 5 to 10 minutes whilst you breathe through your mouth. Does that make sense?
2 minutes remaining.
Yeah, yeah. All right. Yeah, sure. I'll do that from now.
Okay. And the other thing you can do is apply an ice pack to that area. And if and something else that you can do at home, you can avoid picking your nose. I'm not sure if you don't do that. As well as blowing your nose aggressively. And like we identified, the cold air is the biggest problem. So you can use a humidifier at home or use a saline nasal spray to keep the lining of your nose moist.
All right, I'll do. But you mentioned I should put some ice pack. Doesn't that make it more cold? Won't it worsen my condition?
No, actually. So just avoid applying it directly to the skin, but applying an ice pack will help to reduce the amount of bleeding.
All right, sure, I'll do that.
Okay, so something else that we can do if all these measures don't work, we can try something called nasal cautery, which is sort of like a procedure where we try to burn the blood vessels of the nose so that we don't experience any bleeding.
All right, sure, doctor. Yeah.
Okay. So I'd like you to come back if you notice the bleeding doesn't stop with the things that we've talked about, or you start experiencing dizziness, headaches, and weakness, and you notice that you're swallowing large amounts of blood.
All right, sure, I'll do that, doctor.
All right. So I'll see you in a month's time to see how your condition has improved, and I'll also give you a leaflet about epistaxis. Is that okay? Anything else that I can
On
do
to
for
the
you?
next station.
Amazing, doctor.
I had a timer right next to me.
Absolutely, that really helps, right? But
Yes, but I felt like I left out so much more now in data gathering, just trying to make sure that I fit everything within the 8 minutes.
yeah, because that's the thing, right? You already in the last attempt. Can you just tell me how long into the conversation did you realize this was epistaxis? Like, when were you sure that it was epistaxis?
Okay, now it's difficult to tell considering we've done this case before, but I think when I was asking some of the more, I tried to stick to the 3 C's, like he mentioned, when there was no weight loss and there was no nasal discharge, there was no swelling of the blood. And she said no to all the other, to using blood thinners or to smoking or to using any recreational drugs.
Yeah. See, that's the thing, right? As soon as you understand what the diagnosis is, you just have to quickly rule out the critical ones and move on to and understand how it's affecting their life, any risk factors in their life, and just move on to management. So that you can ask, you can, manage those risk factors as well as any way that it's affecting their life, because that's also important in management, because you're not just treating the disease, you're treating the person. So you need to understand the holistic picture. So that was great. I think that was really great. All right, so let's take a look at the sheet. I'll just quickly pull that up. Yeah, this time even I felt that there was a structure too. That was actually good. Even when you were asking about the alcohol and smoking history, Like that was a very good way to say, do you have any other recreational drugs rather than, accusing them saying that, do you take cocaine?
I think the cocaine thing just sort of came to mind at the time. And because I know it's such a sensitive question, I really struggle to vet properly.
Yeah, definitely. Yeah. So let's say you definitely confirm the full name this time. Yeah. You can either start the conversation by saying, am I speaking to Lynn Taylor? That way you are delivering the full name and you're not expecting them to just give you half the name. Right. So
Mhm.
whatever you can control, try to take control of that. Right. So that you don't lose out on the marks. So am I speaking to Lynn Taylor? Can you please confirm your age for me? And that way you're even reducing one question, saving time, right?
Mhm.
Acknowledge the patient's concern about recurrent nosebleeds, clarify the nature of the presenting complaint, ask the patient to describe the episode in their own words, ask about the frequency duration of each episode to assess the severity, clarify the site of bleeding, whether if it's from one nose or both, inquire about any specific triggers. Yeah, this is some question you could have actually asked, like you could have understood like what makes it worse, what makes it better. But you did close it a little bit and ask, do you have, do you have any sneezing or cough during the time when you're having these bleeds? But a good question would be like, anything apart from this, change in weather that you mentioned, do you have anything else that causes these bleeds or, even help stop these bleeds or reduce these bleeds, right? Quantify the blood and ask whether there is any blood dripping down the throat. Screen for red flags. Ask about bleeding tendencies. Review past medical histories or surgeries. Explore family history. Do general physical examination, vitals. Absolutely, that's great. Another good question to ask, and this I'm just saying, because these are the important questions that we put down, making sure that, by asking these many questions, you're good to go. I mean, by this itself, you'll understand what the diagnosis is. But since this is a lady and she's having bleed, you may want to ask about the menstrual history. Does that make sense? Especially since
Yes.
it's related to bleed, just like, and you've already asked about bleeding disorders, but that's also fine. You can also find a little bit about the menstrual history, but not that important. But yeah, you can just keep that in mind if you do have some time. Awesome. Now, explain. I really like the way you explained the epistaxis. That was very well done. Reassure the patient that it's common and not usually serious, accompanied unless accompanied by certain warning signs. Demonstrate the first aid. You did that very well. And you actually had a conversation. This is exactly what I'm talking about. You identified what they are doing and say, I like the fact that you're pinching your nose, but do make sure to lean your head forwards rather than backwards. Yeah, that was actually good. That's where you're actually building on what they are already doing and rectifying something that they are not doing right. So that's very well done, I have to say. And then demonstrate first aid. Advice against nose picking and blowing the nose forcefully. That's good. Yeah, because those are the things that can aggravate the bleeding. Yeah. Recommend nasal spray to keep the lining moist. Suggest petroleum jelly applicants to make the nostrils moist. Yeah. Advise humidifier. I think you did this, right? Humidifier
Yes.
said. This one, I don't think the petroleum jelly you did.
No,
Anything.
that one I didn't mention at all.
Yeah, that you can actually save, that's also something to use. And then you mentioned cautery as well, safety netting, leaflets, follow-up. Yeah. So usually the review is around 1 to 2 weeks, especially if you're doing an anterior nasal packing, because you have to change them. Right. So the changing of the anterior nasal packing just happens like in 1 or 2 days, otherwise it can get infected if you're doing the
Okay.
anterior packing. But why is follow-up important? Because you're trying to see whatever the measures you have given, is it working, right? If it's not working, you can change your management a little to suit them better. Do you understand? So you've given
Yes.
them a way to understand, to help with the nosebleed, and you are just trying to understand if it's working, because according to their lifestyle it might not actually work. So you can actually give them something else that can help with the bleeding, where you can talk about the nasal packing and how to do a nasal packing, right? It's
Mhm.
also something to add on. All right, that was great. Thank you so much, Dr. Natasha. So we will be posting a very detailed feedback on your performance on both 1 and 2 performance, so that you can actually see it. Yeah, we'll actually give you the video recording as well, so you can actually see for yourself, like the change, or how to do a consultation, how you actually improved in the first and second. So this is something that we actually want to get into practice, because every time you do a case, you're doing it, kind of little blindly, thinking what should be important from your perspective of things. And when you actually understand what are the important things, how to structure your conversations and your consultations, and practice it again, there, you go in with a structure, and that's exactly what you guys need to prepare for in the exam. You should go in with a structure, you know, rather than being, like befuddled and thinking of questions to ask. Whenever you're asking a question, you need to have a reason behind why you're asking them. That's very important, because if it's a positive or a negative finding, you can actually bring it back to management. Ultimately, you're trying to manage the patient, so you need to ask relevant questions that might be important in management. Yeah.
Mhm.
Well, that was great. Thank you so much, Dr. Dan. All right.